What would you say, Alna?
So, maybe before we launch deeper into the relationships part, I'm thinking about the relationships social.
Right.
As in at work, productivity. Would you say that there could be a direct link between your productivity at work and interaction with your team members at work?
Yes, I'd go through each one of that. First of all, we're going to spend, I've got several different
relationships
topics on different consequences of sex addiction, including work and socially. I'll go through that when you're ready.
All right. It is 14 minutes past 9, Mkaya. Later on, we'll give you a chance. Don't worry, we are here until 10 o'clock. We'll give a chance to start calling us, but I would like my guests, that is Dr. Shabir Jeeva and Dr. Elna McIntosh, to really start making a case around the sexual addiction and relationships. So we can just continue on that.
Well, I don't like the name addiction, frankly. You know, so there's always.
I agree.
Okay.
Well, because we tend to then want to treat it like any other addiction. Where with alcohol, if you're going to treat it, you're going to take the alcohol away. Cigarettes, you must take the cigarettes away. Now, sex is a physiological function, and you can't take a physiological function, and that's why also with an eating disorder, you know, you can't take the food away. So sometimes people are put on a 12-step program, which works in some cases and not in others. But I just think the word addiction has got it's quite a negative word. So I prefer, we also call it compulsive sexual behavior, and that for me is almost
that's
more
a better term.
Descriptive.
Addiction, they always fall off the wagon. We seem to get better success with sexual addiction than maybe drug and alcohol. Drug and alcohol addicts, they lie, they cheat to us as psychiatrists. They tell us they're not taking the stuff, and we find out all the time. But here, once they are motivated, the success rate is higher. Even in my office, and Elna sees more of this than anybody in the whole of Gauteng, and I'm sure that's true. So sexual addiction is a very derogatory and more of a difficult term. Rather, I like the
compulsive sexual behavior, because it almost describes
CSB. That's the term, compulsive sexual behavior.
So how does it impact on our wonderful, treasured relationships?
Well, can you imagine if you are with a person who you actually don't know? Because I think that is what often happens. You suddenly discover, I didn't know about this person. And it can start off as simple as you open a cupboard and you find pornography is just falling out of this. You know, there are people that have warehouses full of pornography. You know, they keep it. Of course, with the internet, a lot of things have changed. But if you almost think, I don't know who this person is. We got married, we said our vows, and suddenly I discover. And I think that is also the shameful part. And every now and again you'll hear about some Hollywood star who's a sex addict and now he must be treated or whatever. And it is amazing for me that a man or a woman will put everything at risk, because often they do. You know, if you look at Bill Clinton, he's the president of America, and he put his relationship, his job, everything at risk to start a sexual relationship with Monica Lewinsky. Is he a sex addict? Because at the time a lot of books were written about it. But I just think, and probably in his case, Dr. Jeeva, did you think he was a sex addict at the time?
No, I didn't think so, but they were writing a lot of articles.
They were writing unbelievable amounts of books. But sometimes we just, you know, you put this magnifying glass on one sort of situation, you say, oh, look what this man did. And it's not fair to look at. So for me, it's a couple's problem. I always say the one's dysfunction is the other one's distress, and I'm not always sure who's dysfunctional and who's distressed, because a couple sits in front of you and actions and reactions. So it plays out unbelievably in a relationship, but you can't treat it not as a couple, because it affects, you know, and sometimes you have to do family stuff around it, because sometimes these men will abuse their children, will have sexual relationships with their children, which comes out in much later. So you start digging, scratching the surface, and you have no idea what you're going to find.
So sexual addiction can destroy
absolutely
a good family relationship.
Yeah.
Any other relationships?
Yeah, I'm going to explain to you various aspects, the consequence of the similar thing what we were talking about. First of all, socially, these addicts are lost in the sexual preoccupation. So usually it affects families, because they're leading a double life, one their own family life and one another life, and besides emotional expense, it's a financial expense. Secondly, the consequent emotionally, there's a lot of anxiety, and I mentioned earlier about guilt and shame, and there's a main thing that comes through. And then with so much of hiding, ducking and diving, there's boredom, there's fatigue, there's despair, and they might even lead to depression and suicide because the shame that is connected to it. And many people do not know what's behind the scenes. And we, after years of discussing with family and friends and maybe girlfriends, you get the truth, but you don't get it first round in your office. It takes a lot of trust and confidence for a patient, even in a psychiatrist's office, to share this with you. Elna is quite lucky. She has an exceptional practice where patient trusts her a lot, and by the time they come to me through her, the road has been paved and it's a bit easier. The other thing, we are in a country full of HIV, AIDS, and in other countries, this increased promiscuity can cause cervical cancer, herpes, genital warts, all the sexual transmitted diseases. So that's even a medical problem. And next, there's legal problems. The amount of usually when they get in trouble with their wife or with the law, that's the very first time that they are exposed. Either they get caught through internet or phone calls or exhibitionism, but for years and years this continues, and there is help that Elna will tell us more. And next, it's self-evident that if you're going to have this kind of a lifestyle, you have to entertain prostitutes and ladies of the night and travel and do all sorts of double life, and it just bankrupts people and creates so much of hassle. And unfortunately, it's the poor wife or the poor spouse doesn't know about this till the very end. One of the patients, I spoke to him today about, he was supposed to come today, didn't come, and he says there's tremendous amount of loneliness in his life also, because they cannot share any of this good or this secrecy with not even their closest friend. So there's self-pity, there's resentment, there's self-blame. And then who do they blame? They feel that kids or who have been abused many years of their life or early years of their life, they are more predisposed to this type of behavior. I don't know, but this is how the literature seems to be like that. What's your thought of different...
You know what, a lot of them come with a history of, either they were exposed to something, or there was an aunt that seduced them, a school teacher, this or that. But just listening to you now, I often think when we just give people permission to talk, because that's what I do. If a patient comes to see me, I just listen. Who am I to judge what it is that you do? And I think that is probably the most important. This person has never spoken to anybody, and the first time, and maybe that is why, maybe I've got a trusting face, I don't know, but I listen. So maybe it's the motherly sort of instinct in me, but they will tell you their deepest secret that they haven't told anybody, and they'll say to me afterwards, you know what, it's an unbelievable relief to just, you get this off your chest. I've never spoken about it, and now that I've actually, so that is almost the starting of the process. I often get them to write. Okay. I say just write whatever comes into your mind, and it's amazing just that. And I prefer people to handwrite, almost like letter writing. So that is already starting the process just by putting your thoughts on the paper, because often when you write things and you read it back and you look at it, you then sort of realize, my God, I'm reading this. I actually have had sex with 22,000 people or whatever it is, because people can I tell you, we hear unbelievable stories, and I always say to patients, you know what, you are a unique, every couple that sits in front of me are unique, and how we're going to handle this are unique. And I think to make patients feel that they're not going to be a textbook case and everybody gets, you got to listen to what will work for them.
Do you want to add something?
Yeah, the other thing is, it's very hard in a psychiatrist's office to sit down in the first few sessions, and some patient is really honestly going to tell you his secrets as far as sexual addiction. So to make life easy, like as I said, my office specializes in adult ADHD, and I tell them up front, these are some of the qualities. They're very hypersexual all the time. whereas the manic depressive patient, when they're in the manic phase, they are most hypersexual, but the manic phase is not every day, whereas ADHD is mostly the same from the age of 6 onwards. And the hypersexuality is because they're yearning for this chemical that the dopamine that we need. That the exercise does it. Exercise increases the dopamine and noradrenaline. Elna, you want to talk about exercise today, and stimulants do it also. So ahead of time, we have to put it on the plate that they are very hypersexual. They forget things. They're very impulsive. As the Hallowell who trained me says, the ADHD are like heat-filled missiles going around looking for more heat, right? So that is self-explanatory. If you're looking for heat and other people find this jovial, exciting man or woman, say, wow, she's funny, he's happy, let me go talk to him, and that's how they get attracted to ADHD type of person. So it's this missile, the heatful missile that's going around, and then you find another heat, and of course that's going to cause problem. And this is what the extension of our so-called addiction. But we have to lay it up in front and explain to them these are the signs and symptoms, and maybe they'll bite and they'll catch. But if you just sit down in therapy and wait after 10 sessions that they're going to tell you one of these secrets, you're going to be waiting forever. You need Elna there all the time to...
I think when I take a history, I take a detailed sex history, and I would say, Hector, do you have sex with men or women or both? And then you can answer me, because you know what? It's not that I'm trying to find out, are you homosexual, are you bisexual, whatever. Because I also feel if I don't ask, then I'm just going to offer to say, oh, and I take a bit of cocaine on weekends, and then I smoke a bit of dope here. I just ask recreational drugs, and I go through the list. And I'm amazed at how people then come forward and say, you know what, I take cocaine over weekends, and I have learned, I've learned about cat and dog and this and stuff and tuck and, you also learn from your patients, because I don't take drugs, so I'm not always quite sure. Well, that's illegal drugs.
It is 24 minutes past 9. We're talking about sexual addiction and how it impacts on relationships. Give us a call now, Mkaya. Now we're opening the lines on 634-9509. 634-9509. And who's this? Thomas, I'm told that you've been holding on for quite a while now. We're coming to you. Dr. Jeeva, you're going to need your headphones, but we're going to take a quick commercial break. And when we return, it's your calls, Mkaya. Are you a sex addict? Maybe you want to find out. You can give us your little profile anonymously, and then we can tell you that, maybe even give you advice, but especially around relationships, because that's our focus tonight: sexual addiction and how it impacts on your relationships in general, whether it's husband-wife relationship, boyfriend, girlfriend, or even at work. So we're looking at it holistically. All right, we are back with you, Mkaya, on what's your take. My name is Hector, proudly sitting in for Masachaba Moshweshwe. And we're taking your calls now, 634-9509. You want to ask a question on behalf of your friend, or you want to ask a question for yourself around issues of sexual addiction and how it impacts on relationships. And who is this? Thomas, is this you?
Yes, I'm here.
Thomas from Atlasville, thank you for your patience. Been holding on for quite a long time. And you want to ask a question to our specialists in the studio. We are with Dr. Elna McIntosh and Dr. Shabir Jeeva.
Good evening, how are you?
Fine.
Good. Yes, I would like to know, where can one go for this sexual addictive problem? And there's somebody I know who's got this problem, so I would need to know which specialist can you contact.
Well, you can probably contact Dr. Jeeva Dr. Jeeva's in Sandton, but where are you on the East Rand?
Yes, I'm in Atlasville, yes.
Atlasville.
Because there are support groups, sexual addiction support groups. So if you email, because it's Masachaba's email that we use, or if you email Kaya FM, but I'll also put on the website tomorrow. Do you go to the Kaya FM website ever?
Yes, I do.
Because if you go there where the little devil sits on Masachaba's shoulder, you click in there and you go in there and we update that. So tomorrow I'll put a list out of different sexual addiction self-help groups over the country.
Okay, Thomas, thank you very much for your call.